Greetings. This is Group 15's strategy proposal on how do we give meaning to all 54,000 employees of Nissin.
To begin with, I would like to introduce the company briefly. Nissan Healthcare Food Service Company Limited is a company that was founded in 1972 and is also under Batokyu Holdings. The company also focuses on food services, outsourcing to healthcare and welfare facilities, and has around 54,000 employees at the moment. It is these employees who make a significant contribution to sustaining patients in their day-to-day lives by giving them food. Nissan Healthcare Food Service has won numerous awards in the course of years. These are several food industry uh, contribution awards, ESG and sustainability awards, and medals in medical and culinary bodies. Such awards indicate that the company is doing very well regarding the technological sustainability and the quality of food. Nissan Healthcare Food Service Company Limited also won a Sustaina ESG Award 2020 bronze in overalls and service industry categories. It also won the Osaka Prefectural Heartful Company Education Contribution Award in 2021.
Number 1, Finding Idea Award. Number 2, Japan Hospital Chefs Association President's Award. Number 3, Japan Umami Seasoning Association Local Cuisine Contest National Champion 2024. Japanese Red Cross Society's Golden Medal of Merit, October 2015. Next is Nissin's logo and picture with the motto on the screen right now.
Let's define the problems. Although the company knows the effectiveness of meaningful work, most workers cannot clearly state the reasons of why their work is meaningful. This means employees usually fail to find any indivisible satisfaction, such as pride, empathy, and emotional satisfaction in their employment. So what has Nissin done so far to address these problems? To attempt to understand the employee needs so it can be help them create meaning, Nissin has tried to get lots of information directly from the employees. This has come in form of one-on-one employees meeting with direct supervisors and managers. Nissin has also implemented voluntary employee feedback surveys. These measures have been implemented in recent years and are still ongoing. The reason that they took this measure is that they realized that their employees lacked in motivation and empathy. The firm also desires to be a leader in satisfaction of employees, not only at work but also in their day-to-day lives. The result was varied. Individual meetings may make some employees shy, and this implies that they may not have expressed themselves. In addition, there was low rate of survey responses, which could be interpreted as a silence protest. Current challenges. As mentioned before, employees' motivation, empathy, and satisfaction with their jobs are much lower than they should be. This is critical for the company because it strongly values employees' happiness and understand that employees' motivation and happiness are closely tied to its business success. We believe that the external factors including inflation and increased living expenses are the cause of this issue, and we do not feel that this issue are related to errors in HR management. Despite the challenge of solving this issue, if left unaddressed, employee motivation could reach a critical low point. This will eventually lead to unmotivated employees, harming the motivation of other employees. Also, efficiency suffers, and mistakes will be made in food preparation.
With that, we propose two new solutions. The first being a new position at Nissin Healthcare's food service as an employee relations manager. And the second one, which we focus on, is creating an application that allows clients, which is the users of the Nissin's food services, to share their thoughts directly with the kitchen staff. So it's basically an app-based systems for mutual relations. Our solution focuses on the relationships between the two stakeholders. So when the customer knows the employees and the employee knows the customer, it creates a mutual gratitude. We do this by providing QR codes alongside the meals to show information about the people who are responsible for those specific meals. This way, employees would be able to prepare messages for the customers to view, or the customers would be able to send messages back to the kitchen staff. This, again, creates gratitude, mutual gratitude, and lifts the spirits of both customers and the staff. Apart from that, customers can also rate their meals and provide feedback back to the staff, so there can be continuous improvement. Our provided solution is very specific to Nissan, as while some hospitals have QR systems for patients, none have implemented staff profiles and messaging in those very same systems. Our idea, on the other hand, combines the hospital systems with the open kitchen philosophy. This encourages the customers to be interested in what's happening with the staff as well. And we do this because we know Nissan is uniquely a healthcare food company, and we created a solution that leverages the strength of both the hospital and the kitchen ideology. We can link our thesis and our solution on Maslow's hierarchy of needs, as while other areas of employees are being met, the need for self-esteem is going unfulfilled in many areas. This allowing them to read messages will boost their confidence and incredibly up their self-esteem. With this, we developed a multi-phase plan to implement our strategy, with the first being the planning phase, which takes 1 month, consulting phase 1 to 2 months, pilot phase 3 months, implementation phase 6 to 9 months, and the reaction phase, which should be indefinite. First, the planning phase is used to develop the UX and the UI for the app by deciding on a goal and choosing the core features. Second, the consulting phase is used to get feedback and then implement those feedbacks to further improve the apps. The third phase, which is the pilot phase, is used mainly for R&D, as well as starting to implement the systems into the infrastructure. And then after improving upon the third phase, the fourth implementation phase fully integrates the system into the infrastructure, allowing for a smoother change. The last phase, which is the reaction phase, mainly ensures that the app is running smoothly and that the main goal of the app is being communicated across to the stakeholders.
Financial estimates, we are using figures adapted from Signsoft, which is a global consultant and developer of apps. We are seeing that initial app development may range from 8 million at the lowest to 25 million yen at the highest, covering basic features such as QR scans, feedback forms, staff profiles for the staff. We are thinking of using pilot hardwares, which will be tablets with the budget ranging from 0.5 to 1.5 million yens for about 10 to 30 tablets, with each of them ranging at around 50,000 yen each for every tablet for each hospital. Finally, we are using pilot operation and support. Cost will be from 1 to 3 million yen for training staff, fixing bugs, and other on-site testings. We are expecting that the full rollout cost after the pilot phase is going to be incremental costs based on how many facilities Nissin has. The software usually scales cheaply, so the main cost driver of this plan will be hardware and training on the usage of the systems. We are expecting the annual maintenance cost going to be around 10 to 20% of the development cost per year. Usually there will be about server costs, security updates, and small feature improvements.
Several academic studies and examples in the real world also supports our idea. It has been found that the use of simple digital platforms enhances feedback and job satisfaction. The research on Open Kitchen has shown that direct recognition enhances motivation and removes toxic communication. Emirates healthcare-related case studies indicate that the use of digital feedback leads to enhanced efficiency, service quality, and employee satisfaction. Notably, the use of inclusive feedback tools assists in capturing the voices of the silent patients who are mostly overlooked by traditional surveys. This has shown to increase participation and inclusivity for this population. In Sensor's Health case, usage of QR codes on patients' trays has made sure that feedbacks are quickly conveyed from the front room to the back rooms, ensuring efficiency and satisfaction for both parties. Below are our references. Anyways, to summarize, our proposed app will establish a two-way communication between the patient and the kitchen staff by ensuring that the employees are visible and their contributions valued. Nissin can bring true significance to work with the employees. This also translates to increased motivation, improved quality of service, and the success of the company in the long term. Anyways, it has been Group 15. Peace out.